Hello students, it's Professor C. I'm going to go over different types of insulins and how to use an insulin pen. So going over here to our PowerPoint, why use a pen instead of a vial? Oh, quite a few different reasons. It's easier to draw up. You can use it if a person can use it if they're visually impaired. They can hear the clicks on it. We'll go over that in just a little bit. The label is easier to read. You have less syringes lying around, which you guys are all adults. You understand the significance of that. And then people, patients and nurses alike, are less likely to make a dosing error. So with insulin, there are 7 main different categories of insulin. Each of them work a little bit differently, so we're going to go over all of those. First and foremost, I want you to know this insulin. This is one of the most common insulins that is given in the hospital. It is Humalog. It hits you like a log. It works really, really fast. And in clinical students, I will actually take the pen and I will kind of like whap at you. This is how quickly it works in your patient. It hits you like a log. It is your race car insulin. That's why I got my cute little race car here. Oftentimes with Novolog pen, there will be orange on it, so I want you to associate that with a race car, that it works quickly. If you can see here, the onset is in 10 to 15 minutes. And so students, as the nurse, I want you to counsel your patients. This is not the type of insulin you take and then drive to the restaurant, because your patient might go hypoglycemic before they arrive. This is what Novolog looks like in a vial. You can see the orange right here. It's 100 units per milliliter. That's a pretty standard, that's the standard concentration. We've got 10 milliliters in this one vial. This is what our Novolog pen looks like. Excuse me. Oftentimes this is what's used in the hospital now. Again, you can see the orange here. Associate that with your race car and that it works really quickly. There is a different brand called Humalog. It too hits you like a log. It's red, it's your race car, and it is the same concentration. So going to price, you might hear sometimes people complain about the price of insulin, and it is expensive. You can go to GoodRx and see what the cost of prescriptions are generally. So if you look here, this is generic Novolog in a 10 milliliter vial, and just one vial of it, you're looking at about $70 to $90. If you get it as a pen, now notice students, that's just 3 milliliters, not 10 milliliters. So for 3 milliliters of insulin, that would still be $26. So if you were to times it, make this 10 milliliters, that's still considerably more expensive. And then this here is generic Humalog, but that's in the vial. Next we have regular insulin, and I want you to burn the image of this R into your brain. This is the only insulin that you can give IV. That's it. There's 7 different types of insulin. This is the only one that can be IV. You can still give it sub-Q, and this preceded the Humalog race car ones that we have today. Its onset is in about 30 minutes. You can still give it sub-Q. If you give it IV, it works like almost instantly. It works very quickly. So that's why students, if you've been in my clinical and if you get an order for IV insulin to give it to your patient to make their potassium go down, you always want to give an amp of glucose first and then give the IV push insulin. So anyway, regular insulin, you can give it sub-Q. It's the only one you can give IV. There's always this pronounced R. And let me show you some examples. So we have Novolin R, we have Humalin R. These are different brands, but it's the same concentration. It's still regular insulin, and you can give it IV push. We still have this around, even though it doesn't work as quickly and effectively sub-Q as what the race car insulins do. I'd like to show you this down here. You can get Walmart regular insulin, this brand right here, for 25 bucks a vial. This is life-changing for patients. I will point out though, so if a patient loses their insurance and they are diabetic, they can get insulin from Walmart without a prescription for $25 a vial. However, the biggest mistake I've seen in practice, though, is patients will think that regular insulin is interchangeable with the Novolog and Humalog insulin. The peak and onset and duration is just a little bit different. Your Humalog is your race car one, and it works really, really quickly. But the regular insulin It works a little bit slower, but it also stays in your system for longer. So the regular insulin stays in your system for 5 to 8 hours, whereas the Novolog, the race car one, is in and out of your system within 3 to 5 hours. And so if patients say that they're going to lose their insurance and just get the Walmart $25 insulin, please let them know that they need to speak with their provider. They may need some dosage and adjustments so that they don't go hypoglycemic. Our next insulin is a intermediate acting insulin, and it's called NPH, or sometimes Humulin N or Novolin N. We've got this big N right here, and I want you to notice, students, this one's cloudy. This is the only cloudy insulin. When it's the intermediate acting insulin, it's the cloudy white stuff. It kicks in after 1 to 2 hours, but how long it stays in your system is quite a bit more variable. It can peak anywhere from 4 to 12 hours. Duration can stay in for half a day or 18 hours. So a lot of times we don't see this by itself. We see it combined with something, and we'll go over that later. But just know that N is the cloudy one, and it's intermediate acting. Here's some more examples. So we have Novolin N. We've got the pronounced N right there, and how much of a vial of it costs. All right, so that Novolin N, the intermediate acting insulin I was just telling you, it's usually mixed with something, so it's usually not alone. Notice that it's cloudy. It's not as predictable with the timing, and we just talked about that. And then we're going to talk about sometimes patients, they will get a injection of either Novolin R or the Novolin or the Novolog combined with the intermediate acting stuff. And if you're going to give them a shot of both, just draw it up in the same syringe. However, you're going to always want to draw up clear before cloudy, and that'll make more sense a little bit later. Lantus and Levemir. So Lantus and Levemir, they both start with the letter L, and I want you to understand that they last and last and last and last. Onset is 1 to 2 hours, but it doesn't really have a peak. So there's no point where that medication is like mostly intense. It's a really steady, what they call a baseline or a basal insulin. It lasts anywhere from 18 to 24 hours, so usually this is dosed once a day. Some of your diabetics, once in a while we will find a patient who metabolizes this a little bit quicker and we'll dose it twice a day, but usually it's just once a day. So as a nurse, it's important to find out if they take it in the morning or at night, and then we can mimic that when they're in the hospital, so that when they go home, they're still going to be on track for taking their medications how they would take them at home. So I also tell my patients too, with Levemir, our long-acting ones, it's their Sunday drive. It's a once a day. It's long lasting, and if they take it just once a day, sometimes this is all the insulin that people take. They just need a basal insulin, a once a day insulin to just kind of keep their sugars in check. These guys can take it and then go to the restaurant. It's not like they have to hurry up and eat something, because it doesn't hit them like a log. It's their Sunday drive. And I've found over the years practicing as a nurse, this has been really helpful for patients to understand the difference. This one's their slow acting, long lasting Sunday drive, and that this one up here is their race car. So sometimes that visual helps your patients get that right. Lantus is your other long-lasting insulin. It's a little bit better. It's a little bit more stable. Still no rush at all. You can take it and go to the restaurant, and it is just fine. A little bit of cost showing it for you here on GoodRx. So we've got Levemir, the vial, and the pen. They're both kind of pricey, because this is just 3 milliliters of insulin, so it's almost 3 times more expensive to get the pen. And then Lantus, you can usually get that pretty cheap. So as you notice, students, a lot of times we give Lantus in the hospital now instead of Levemir, and you could probably guess why. This one is newer on the market. It is another long-lasting insulin, but it's ultra long-lasting. It lasts instead like a day and a half, sometimes longer. And so patients will take a little bit lower doses of this once a day, and it's better to have them keep an even basal blood sugar. Again, onset is 1 to 2 hours. There's no pronounced peak, so they can take that and then drive to the restaurant. However, as you can see here, insurance doesn't always like Tresiba, even though it may work a little bit better. One vial of it is over $100, and if you get 5 of those pens, we're looking at about 500 bucks. Or, and then I will talk more about this. This is a high dose insulin for people who really struggle with blood sugars and need higher doses of insulin. You don't see the 200 units per ml often, but as you can see, insurance doesn't always like that one. All right, so we are mixing it up. So we've got pre-mixed insulin. Going back to our intermediate acting insulin with the N, that is what this is. So as you can see, it's a cloudy insulin, but it's also combined with something else. So 70% of it is the Novolin N, and then 30% of it is the Novolog. Okay, so, or the regular insulin. I think this one's regular. So regular and NPH combined together. And the purpose of this, students, is to just make compliance easier with our patients. So a lot of times patients will take this twice a day. So you have to roll it before you administer it, because you want to make sure that it's evenly distributed. It likes to separate if it sits for too long. And this way the regular insulin portion will cover them for breakfast when they first take it in the morning. Then the intermediate acting will cover their lunch and they won't have to take another injection. At supper time, they'll take their second injection, and the regular portion of that will cover their supper. And then the NPH portion will cover their bedtime snack. So with them peaking at different times, with one injection, it will have 2 different peaks. It will peak with the regular and peak with the NPH. And then this patient's just taking it twice a day. So it does come in a pen, and it does come in vial, both Humulin and Novolog. So just make sure you watch your labels. They do come as combo ones, and usually insurance doesn't balk too much with that. So you've got a patient that can have 2 injections per day. It can have the peaks at different times to cover 3 meals and a bedtime snack. And for a 10 milliliter vial, you can get that for like $70 to $90. For 10 milliliters, so that's actually a really good price. And if you can get that as a pen too. It's usually pretty reasonable. So even though this is an older way of managing insulin, it's pretty cost effective. I just have another example here of all the different combo insulins. So we've got the plain NPH, which you don't see very often. You'll see this more in the hospital. Sometimes we will draw up regular insulin first and then draw this up. And then we've got the 75/30 and 70/30 with that. And then lastly, our last type of insulin that we're going to talk about today is our ultra concentrated insulins. Be careful. Insulin is already a high-risk drug. When it's concentrated, I want you to be extra careful. Insulin dosages are already really small. This has the potential for really hurting somebody. So we've got examples of 500 units per ml regular insulin. Then we've got the Tresiba, which I showed you a picture of over here, but that sometimes comes in a 200 unit per ml. So that's what it's talking about right here. And then 300 unit insulin Garline. So Garline is more like your Levemir and Lantus. I'll show you a picture here. So this would be similar to Lantus and Levemir, but instead of the 100 units per ml, it's 300 units per ml. So Toujeo is usually reserved for patients who need a much larger basal insulin because they're really struggling with their blood sugars. So they might be switched to Lantus in the hospital, but if they took, for example, 10 of Toujeo every day, we would be giving them 30 of Lantus in the hospital because the concentrations are different. And then Tresiba, I just want to point this out, just watch your labeling. If your patients are able to bring in their insulin so you can actually look at it, because they might tell you they're on Tresiba but not know what the concentration is. So I don't know if they would be on regular or the concentrated. And then we don't see this too often. Again, this is for our really our diabetics who are really struggling with control, this is ultra concentrated. This is 500 units per ml. It does come in a pen. This is the only pen that has this color. So if your patient brings in their med and you see this, then that should be a red flag for you that you really need to be careful transcribing their meds and let the provider know. All right, so now we are going to talk about how to give an insulin injection with a pen. Okay, so I've got two example pens here. I've got our Novolog, okay, so it's going to hit us like a log, and our once a day Lantus. All right. Now, sometimes this can be really hard to read out of a book and see how to do it, but if you see a video, sometimes things make more sense. So we have our patient today, Mr. Tangerine, and we are going to give him some insulin. So I know with my race car insulin, I'm not going to give this to him until I know like breakfast is getting served, because its peak is in 10 to 15 minutes. We have our alcohol. This is what we're going to use for an alcohol wipe. So what we're going to do first is we're going to wash this off really well with alcohol. Think of your pens as a vial, okay? So it's a vial of insulin, so you're going to use this again and again and again. So anytime we draw up medicine from a vial, we're always going to wash it off with alcohol first. So we're going to do that. And then these are the needles that we would have in the hospital. So we are going to open this up, and I want you to look right there. That's a needle, so don't poke yourself, all right? And can you see the orange is pretty far down on there? So after I've cleaned this with alcohol, we're going to screw this on righty-tighty. All right, so we've got this on. And then the next thing, students, I want you to do, every single time you use a pen, you need to dial this up to 2 and kind of burp it, or prime it is the proper term. So you're gonna do that, and I seen just a little bit of insulin come up. Insulin doses are so tiny. We need to prime that needle with some insulin first, so that when we administer it, the patient gets the entire dose and not part air and then some insulin, okay? So I've primed this. I've checked my order. We are going to give him 5 units of insulin today. So we're going to click this up to 5. And you can feel it click each time, which is how people who are visually impaired can administer their own insulin. So now that I've clicked this up to 5, I'm going to have another nurse verify my insulin, that I've got the correct insulin. They're going to check the order. We're going to talk about what the patient's blood sugar was. And we'll say that the patient's blood sugar was 205 today, and we're going to slide him with 5 units. So I'm going to pick my area, and I'm going to wipe it off with alcohol. These needles are so small, you don't have to like pinch up a huge portion of the skin in order to give it. These are very fine needles. And I want you to see what this has, a safety needle on it, or a safety cover. Once you give it, so you're going to have the needle go into your patient, and then you're going to push down on your button, and then you're going to count 6 bananas. 1 banana, 2 banana, 3 banana, 4 banana, 5 banana, 6 banana. We'll go over that in a little bit, why we do that. And then you lift it up. And then I want you to see that the safety is engaged. Once it retracts once, it will not retract again. So if you've went to administer your insulin and accidentally engaged the safety before you administered it, you have to get another needle, okay? Because that will only retract one time. And now you can see that there is a safety piece over that, because now it's a used needle. So now you can't hurt yourself, all right? So then we would put our cap back on and go put this in the patient's drawer. We're also going to give our patient 10 units of long-lasting Lantus, our Sunday drive, okay? And so we're going to repeat the process. This is a reusable vial. We're going to clean this off with alcohol. We're going to open this up, and as you can see, the safety, so you can see that needle, the safety is way down there. We're going to righty-tighty it again. There we go. All right, we're going to kick it up to 2. You can see my 2 right there. Okay. We're going to prime it. There we go. And you can see just a little bit of insulin up there. You can see what the safety shield looks like. And this is what I was talking about, students. If you go to give If you go to give it and you accidentally lose contact with the skin, and you see this is like the safety shield is engaged, well, now you can't give your insulin. So you have to take your needle off, and you have to get another needle, because now the patient's not going to get their medicine. So we'll wipe this off with alcohol again. Righty-tighty this on. We're going to crank it up to 2. I'm going to prime it or burp it or whatever. We'll dial it up to 10. We'll have another nurse verify it, make sure that we've got the correct insulin, correct dosage. We have Mr. Tangerine. We're going to find our little spot here that we're going to give our insulin. Retract the needle, and then once keep contact with the skin, administer it, and then count 6 bananas. 1 banana, 2 banana, 3 banana, 4 banana, 5 banana, 6 banana. You have to hold it on there after you have depressed the button for 6 whole seconds. Otherwise, the patient's not going to get all of their medication. This is a spring-loaded mechanism in here, and if it doesn't stay in contact with the patient, they're not going to get all their medication. All right? Now, one of the reasons why we say that insulin is such a high-risk drug is that the dosages are so small and can have such a big effect on our patients. You can see the safety is engaged there. I'm going to try showing you guys how much. So we're going to crank it up to 2. There we are. Got that primed. And then I'm going to show you what just 4 little units of insulin. 3 banana, 4 banana, 5 banana, 6 banana, 7. There we are. Just that much. Just that tiny little drop. Okay? Like that can really affect our patient quite a bit. We're going to go back over to our PowerPoint, and I'm going to show you what the inside of an insulin pen looks like. So this is an insulin pen that has been taken apart. Here is the spring-loaded mechanism. And so when we depress the button and then we have to count our 6 bananas, this way it has a chance for this to completely engage and then get all of that insulin pushed through the needle into our patient. So make sure that you're holding it on the patient's skin for a little bit. Okay, I hope that helps. I hope that makes a little bit more sense on the different types of insulin and how we use an insulin pen. If you have any questions, please reach out. Thank you.